Hi Annie Jean's program, it's James. So today I wanted to talk a little bit about managing stress levels a little bit, but a specific aspect of that, and talking about things that you can and can't control. Not diabetes, the NDSS, which is the organisation that for diabetics allows them to order supplies like fingerprint testing strips and all that kind of thing at a discounted price, released a document that was looking at this, and I thought it was really helpful and it was something that I wanted to share with you. Now, the document is fairly diabetes specific, and I know not all of you guys have diabetes, so what I'm going to do is I'm going to talk about the aspects of it that actually relate more generally, but I'll give you a copy of the document that they put out so that you can see it in its entirety. So what we can see at the moment is that it's a little bit scary at times, and I know every time I'm out at the shops, I'm seeing lots of people who I can tell are just quite anxious about what's going on. I saw a lady at the shops yesterday who was covered over in a hoodie and a mask and gloves and looked like she was about to scale Everest. Just walking the shops of Woolworths, walking the aisle of Woolworths. There's a lot of fear around, and a lot of what we're seeing with the panic buying is people feeling like they need to take control back in their life. It's very difficult at the moment not knowing what the extent of this pandemic will be, how long it will last, and so what we're seeing a lot is people just trying to take whatever steps they can do to try and regain some sense of control over their life, and whether that's buying a truckload of toilet paper to stock up, or panic buying flour or whatever else we've seen. It's just a symptom of people not feeling like they have control, and that can be really stressful, particularly if you're responsible for others. If you've got people to care for, or if you've got parents that you need to care for, or kids that you need to care for, or grandkids that you need to care for. And so I really thought this was a really powerful thing and a very interesting thing to share with you guys about looking at some of the things that you can and can't control. I'll start with the negative first, so the things that you can't control. So, and then I'll look at the things that you can control, so we'll end up on a little bit of a higher note. But some of the things that you can't control in this current pandemic is that you can't control whether you or your friends or your family get this virus, this COVID-19. Yes, there's lots of things that you can do to minimise your chance or your risk, and staying home and social distancing and washing your hands and hand hygiene, which we've talked about. That's all really, really important. But if you do happen to get it, and the odds are that, in the coming sort of probably 12 to 18 months, this virus will gradually move through the population. But the good news is that is treatable, and it's quite helpful if we've got the health resources, which is all about what we're doing at the moment to try and keep those health resources free for people who need to use it. So you can't control whether you get it or not. And what I mean by that is not your fault. If you happen to get this virus, and you absolutely may not. I'm not saying everyone will, but lots of people will. And if you do happen to get it, it's not your fault. It's not something you've done that's wrong or anything like that. It's not something that you need to blame yourself for. And that's a really, really important point to make. So the next thing that I want to talk about is, and when you have a look at it on this sheet that I give you, this is one of the more diabetes specific ones that I won't address so much because it's not relevant to everyone, but I do want to clear this up. It says that diabetes makes you more vulnerable. And that's actually not quite true, but what they're saying is that if you having a pre-existing condition like diabetes, could be heart disease, could be lots of other chronic diseases, does make you more at risk to getting more sick if you do get it. but it actually doesn't make you more vulnerable or more at risk of getting it. You have the same risk of getting the disease as anyone else in the population. It's just if you do, there are some, it can make it more serious. Not always, but it can make it more serious if you do get it. So I just wanted to clear that thing up on the sheet, that if you're reading it, if you have diabetes or indeed any other chronic disease like cardiovascular disease, for example, it doesn't make you more at risk of getting it. It just makes you more at risk if you get it, if that makes sense. Hopefully that's clear. I didn't want you guys reading that thinking, oh, I'm diabetic, so it's somehow the virus is going to hunt you down more. That doesn't work like that. That's not the case. The next thing that you can't control is you can't control the need to stay home. Everyone is being forced to isolate themselves a little bit more from each other, and it's a really unfortunate time. If you do happen to like being social, it's a really hard time for a lot of people. But that's one of those things that's outside of your control. That's the health advice that we've been given from the government, and it seems to be working when we look at the stats each day. So you can't control the need to isolate. All we can do is do what we've been asked to do, and it's a hard thing for a lot of people, but it's outside of your control. So next, you can't control other people's feelings or reactions to this. Again, like I mentioned earlier on, I'm seeing, and I'm sure you guys are seeing, a lot of fear and uncertainty, and maybe you feel a bit of that as well about this thing. And so you can't control other people's reactions. So if you're looking around and people are out panic buying or getting really anxious and getting really worried, you can't control how other people feel. And so it's really important to not let that panic rub off onto you. You can only control how you feel, and we'll get to what you can control soon. But it's really important to support other people, to be looking out for other people, but not let how other people respond to this impact or affect you, because you can't control how other people feel and react. So the next thing that you can't control is you can't control what's available at the supermarket. Things come and go, and as I mentioned before, you can't control other people's reactions. If everyone's buying toilet paper and you can't get a hold of it easily like you used to be able to, it's not helpful to run to the shops every day looking for toilet paper and then getting really depressed or disheartened or anxious or scared if those things that you normally like to buy or need to buy are not as available as they used to be. So the best thing that you can do is buy what you need. For things like toilet paper, I was actually at Woolworths at Erina Fair yesterday, and there was an entire aisle full of toilet paper. And the crazy thing is, there was lots of people when I was walking into the shops. I saw a lot of people walking out of the shops with toilet paper. But while I was walking around the shops, actually there wasn't very many people who were panic buying and ripping it off the shelf. So I'm hoping that means that people are realising that this is not going to be as crazy as they initially might have thought, and that some of that panic may have settled down. But don't find yourself getting too anxious about what's available or not available at the shops, because again, it's not something that you can necessarily control. There's lots of, Coles have the community hours earlier in the morning, where some of those higher value targets, if you like, things like toilet paper and that kind of thing, are easier to get, and they'll quarantine it, excuse the pun, for people who need it, people who have pre-existing conditions, or more elderly people. Now, we spoke about the advice a couple of weeks ago about Aboriginal people over the age of 50 or with pre-existing conditions being encouraged to stay home, and that's still the case. If you can get, one of your kids or your grandkids or a friend or a neighbour who is not in that category to go out to the shops to get it for you, that's better. There are still avenues to buy things like toilet paper online, so looking at that kind of option may be helpful as well. But don't get too anxious, scared or stressed about what you see or don't see in the shops. That's outside of your control. So the next thing is the availability of healthcare services. So all healthcare services are still available. You can still see your GP. You can still see allied health professionals. You can still go to the hospital if you need it. None of those things are changing, and none of those things look like they will change at this point in time. And I don't anticipate, from everything that I've heard, that will be the case. It will be I can't see a scenario where access to healthcare would change, and in fact it will get easier and probably more accessible as we go along through this. But the way that you access it may change, and so your GP may elect to see you or do a telephone consultation or a video consultation, and so the availability in terms of how you access those services may change a little bit. Again, that's not something that you have a lot of control over. I know at the moment, if you want to go in and see your GP, I believe you can still do that, but you may have individual surgeries saying that we're seeing all patients over the phone, or screening people over the phone first, or doing video conferencing to start with at least. And so there may be a few changes that happen around that, and that's not really something that you can control. Individual businesses and healthcare agencies will make those decisions, and unfortunately that's not something that you're going to have a lot of control over. So don't get anxious or stressed about that. It'll be different, it'll look different, it'll feel different, same as this. This is all very new and different. For me as well, I know Nikki as well, this is all new to us, but the best thing that you can do is just roll with it and not get too anxious about it. So we're almost done through the things you can't control bit, and we'll move on to the more positive stuff in a second, I promise. So the next thing that you can't control is you can't control scary stories in the media. Thankfully, in Australia, we're handling this pretty well, in my opinion anyway. And while there are scary things that we see around us, we're not in a position like some of the stories that we see in Italy or the US at the moment. But that doesn't mean that you won't hear or see those stories, and for a lot of people, they'll be thinking, gee, I hope this doesn't happen here, and we all should be thinking, gee, I hope this doesn't happen here, and aren't we lucky, and aren't we glad that it hasn't happened here, and hopefully it won't. If we look at how it's happening at the moment, there's a good chance that we won't see those kind of things here. But nonetheless, having those stories circulating around can be really frightening and scary for a lot of people. And so you can't control what's on the media. The media will report whatever they want to report, and that'll be completely outside of your control. You can, and I'll mention this again in a second, you can choose how much of the news you watch. You can choose the source at which you get your news from. If you're getting all your news information from Facebook, that's maybe not the best thing. If you're relying on the daily 8 a.m. Updates from the Premier and health ministers, maybe that's a better source. If you're looking only at what's happening overseas and not looking at what's happening here, that may not be the best thing. If you're choosing to only focus in and seek out and search and click on and all those kind of things, the negative or the scarier type reports, then you can choose not to do that. But you can't choose those stories being out there in circulation. Finally, the last thing that you can't control is you can't control things being cancelled at the moment. I've had a holiday cancelled, which I'm quite bummed about, and we'll lose a bit of money over that. But unfortunately, that is what it is, and I can't control that. And you might have had concerts or outings or lunches or social events that you were really, really looking forward to that are now not happening. And that can be really disappointing. And you may be tempted to take that to heart, and that's normal and that's fine, and you're absolutely allowed to be disappointed by those things. What I wouldn't want to happen is I wouldn't want you guys to take it to heart so much that it really starts to impact negatively on your mental health. And so it's really important to realise that that's outside of your control, and it's because it's outside of your control, you can't take it to heart too much. And I know that's easier said than done. So that list of things that you can't control, the idea of this document or coming out, or the idea of what I want to get across is there's a real skill in being able to identify the things that you can't control in life, and then be able to let go of them and say, look, because I can't control them, I'm not going to let it affect me. Again, easier said than done, but this is the skill that I want to get you guys thinking about and practicing is, can I control this? If I can't, how much can I worry about it? Worry's one thing, but really letting it get to you and affect you and stop you sleeping and all that kind of thing over it isn't helpful, and actually doesn't help the situation at all. So there's a real skill in being able to identify those things and then actually be able to release control of that and say, you know what, that's outside of my control. I don't have there's nothing I can do to impact that. And so I want you to have a think about that. And I'll come back to that in just a moment. But I want to go through some of the things that you can control. So the things that you can control, there's lots of them. So the great thing is you can choose still how you eat. Keeping a good, healthy diet, and we've been talking about this for years now, the benefits of good diet and physical activity. And I spoke last week about the impacts of some regular physical activity on your immune system. So you can control how well you eat and your activity levels. You can get out, go for a walk. You can control all those things. That it's up to you whether you choose to use this time to binge watch Netflix and eat Maltesers. Nothing wrong with Maltesers. I love Maltesers, but if you are only doing that, that wouldn't be good for your health. But that's something that you can control. So you can control the amount of activity that you do, and you can control the quality of your diet. The next thing is you can control your mental health. So you can control. You might not be able to go and visit your friends, but you can still contact them by phone. You can still make sure that you're connected to them. You can still engage in one of the many video calling tools, whether it's even if you're on the Facebook page, and you have Facebook, there's Facebook Messenger. You can do video calling with it really easily to other people. If it's Zoom, if you happen to have Zoom, if it's Skype. There's lots and lots of free video servicing, and the video conferencing stuff is a bit odd at first, but you do get used to it, and it's really not that bad once you get used to it, and it can open up really good opportunities to maybe connect with people in ways that you wouldn't necessarily always do. I've been able to talk more with my family over in America, which I keep in contact with by text a lot, but because we're all forced at the moment to use video conferencing or video messaging technology, it's been more in the front of my mind to use those avenues to contact people who I wouldn't probably see very often. So friends interstate, or for me, family internationally. It's been a good reminder that those tools exist to connect with people and really make sure that you do feel connected socially. And you may have heard people using the term not social distancing, but physical distancing, because we should be physically distancing ourselves from other people, but not socially isolating ourselves from other people. We still need to maintain connection. And so how much you reach out to other people, what technology you choose to engage with, and how you choose to connect in with your friends and your family and the people who you love, is something that you control. That is absolutely something that you can decide to do or not do. So that's something well within your capabilities to control. So the next one I want to talk about is you have control over asking for support. So sometimes you might feel that, oh, it's not that bad, or I don't want to bother people, or everyone's going through such a hard time. I don't want to put my problems onto other people. But it's absolutely within your control to ask for the support and seek out the support that you need. If that's mentally, reaching out to psychologists or counsellors or your doctor to talk about that kind of thing, or if it's just your friends to say, you know what, I really just need to hang out and make yourself a cup of tea with someone on the other end of the phone and have a bit of a chat. That's something that you can do, and it's up to you to ask for the support that you need. As I've said, it's a hard time at the moment. It's a hard time for everyone, and so it's absolutely necessary and really important that if you need help, either physically, getting groceries from the shop, going out for food, cooking food, cleaning the house, whatever it is, however practical or impractical or physically driven or mentally driven it is, it's in your control, and you are able to ask and should ask for the support that you need and find ways to access that. That's really, really important at the moment. The last one that I'm going to talk about on the list is knowing who to contact. What I'm going to more broadly say is controlling where you get your information from. So the government websites are great. Again, if you're on Facebook, make sure you go and follow New South Wales Health or New South Wales Government, because they put out daily updates of what's going on. Now, it's up to you to choose how much you engage with that. If looking at stats and all that kind of thing makes you feel more aware of what's going on and makes you able to cope with all this better, then great. Go and find the information, make sure it's the right information. As I said, the New South Wales Government, New South Wales Health are great places to start. And they give out really, really comprehensive daily updates at 8 o'clock in the morning on TV every morning. Or they release a Facebook post at the end of each day, giving you access to where confirmed cases are, how many, all those kind of things, what the latest health advice is, what the health orders are around restrictions or anything like that. So that happens daily. So if that's something that you want to and feel is helpful for you to engage with, those options are readily available to you. I wouldn't just be going to any website or just trolling through Facebook and finding out, jumping down the rabbit hole of how 5G is somehow affecting, all of this. It's not. I'll just clear that up. But you know what I mean, like just finding the latest conspiracy theory or whatever else is not helpful. So being in control and choosing how you access the information and what information you access. Make sure that the sources are trusted. If you have any questions about whether the information is good or not, or where to get information, please let us know, either myself or Nikki when she calls. More than happy to help you out with that. So make sure that you're in control of how much information you access according to what is helpful for you and the quality of that information. The next thing that I want to say that you can do something about is observing the physical distancing that we've been talking about. If you're diligent with that, and you're staying 1.5 meters away from others, then your risk of catching the virus drops significantly. The virus is spread by droplets, and those droplets will fall to the ground within about 1.5 meters. So if you stay 1.5 meters away from people, that's something that you can do, that's something that you can control, and that can reduce your risk of contracting the virus. The next thing, as we've talked about the last few weeks, is good hand hygiene, washing your hands for 20 seconds, etc. I won't go into that too much. If you need a refresher on that, go back and see the other video. Learning what the symptoms are of COVID-19 as well is something that you can do and keep on top of. And again, the government websites are great for that. There is a 1-800 number, so it's the coronavirus line, so it's 1-800-020-080. And so if you think that you've got any symptoms, you can call that line, and they can give you some information about that. I believe Nikki handed out some resources the week before we went online that had some of that information on there. So make sure that you know what the symptoms are, and then call or seek some medical attention if you think you might have it. They're reducing a lot of the restrictions on who gets tested in certain areas now, so you may need to come in to get tested, which is fine. That's a good thing, to be tested. So make sure that you're aware of what the symptoms are. Another thing that you can do along that line is you can control what you do if you do happen to get sick. So if you do have, a sore throat or a runny nose or a cough, you can choose to either ignore that and say, oh, it's probably a cold, it's probably nothing, I don't, what if I do get tested and I do have it and I have to go to hospital, or, I get really sick, or, what if, I'm sure it's just nothing, or I won't tell anyone, or anything like that. I know a lot of people have done that, but it's your choice what you do. If you do have any symptoms, you can ring up, find out if your symptoms warrant you getting a test. If it does, you can come in, get tested, and know the answer for sure. Get medical attention. We have a lot of spare capacity in terms of hospital system at the moment. We have coronavirus wards in the hospitals. We have a large amount of ICU space available on the coast. You're not clogging up the health system, or some people feel that, I'm not that sick, maybe I should just wait it out and see what happens in case other people, I don't want to be a burden on resources or anything like that. You're not. The resources are there for people who need it. The other thing too is if you just play it cool and pretend that it's not as bad, maybe it's just a cold, and it is the virus, and you could be spreading it to other people. So it's your choice. It's your choice and in your control about what you do if you do happen to get sick. So the last thing I want to leave you with is I want to leave you with a little bit of a challenge. And so some of the things that I've gone through off this NDSS document may be relevant, may be interesting, maybe irrelevant to you. What I'd like you to do is have a think about writing down on a sheet of paper the things that you notice around you, maybe the things that you're getting a little bit anxious about or concerned about, and categorize those things into things that you can control and things that you can't control. If you're in a household with other people and they're freaking out and losing their mind, how well can you control that? At what point does that become out of your control? Are you concerned about other things? And so I mentioned before that there's a skill in being able to identify things that you can control and things that you can't control. And so the challenge is that I'd really love you guys to think about making a bit of a list and adding to it as you need to, and thinking about things as they come up, where if you feel yourself getting a bit anxious about something, get used to asking yourself, is this something that I can control? If it is, what can I do to control it? What can I do to reduce the negative impact this is having on me. If it's something that you can't control, then how do I go about letting that go? How do I go about not necessarily disregarding it? I mean, it's quite normal and quite reasonable for you to be worried about what's going on at the moment. But there's a difference between being concerned or worried and really being overrun with anxiety about what's going on in the world, or whatever the thing is that is affecting you in that way. And so working out ways to be able to let that go in a healthy way, and whether that's talking through that with a counsellor or a psychologist, or doing some meditation. We've gone through a lot of apps before about ways you can do that. So it might look like something like that, but it will be different for everybody. And if you need help with that, let us know. So see if you can have a go at working out or looking at the things that are concerning for you, and categorizing into things that you can control and things that you can't control. And where you can't control them, see if you can work out ways to let them go. Let me know if you have any questions, guys, but I hope you found this helpful. I'll see you later.